Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
It's probably the greatest scientific achievement of our lifetime.
The coronavirus vaccine.
Over 4,300 new cases in a single day.
The struggle to provide care.
The drumbeat of demand for internet never slows down.
The big move for broadband.
There are many who are not going to return.
A reality of hurricane-worn Cameron Parish.
Hi, everyone. I'm Kara St. Cyr.
And I'm Andre Moreau. Much more on those top stories in a moment on this week's edition of SWI.
But first, the latest coronavirus numbers in the state. Those include almost 1,600 in hospitals right now.
At his Thursday news conference, the governor and a Monroe doctor begged for people to please do what health experts are saying we must do.
More compliance with mask wearing and distancing is absolutely essential. So as you make your plans for Christmas and for Hanukkah and for these holidays, if you're considering travel, please don't. If you're considering normal activities that you would engage in any other year, please don't. If you're thinking about having multiple households and multiple generations all celebrating together, please don't. And it pains me to say this, but I am absolutely confident that hundreds of families will go through Christmas without a loved one that was because we lost that person because of what happened at Thanksgiving. So the worst thing we want to do is compound that again. Let's be patient, let's be diligent, let's do what is required of us, and let's look forward to the end of the pandemic and celebrating Thanksgiving and Christmas next year the way we normally would. And you can show your love for your loved ones without being physically present with them. In fact, it's a damn poor way to show love to a loved one to give them COVID. Let's not do that. Everybody has a role to play. It is extremely important, and it has never been more urgent than it is right now. There is more COVID in Louisiana right now than at any time in this pandemic.
None of us want to look back next summer or next fall on a sadness of having lost a loved one or a close friend that we may have had anything to do with because we did not do the best we could to protect that loved one. We don't want to have that as part of our next year's experience of what if we had done thus and so.
And now we'll look at some of the other headlines making news across our state.
Earlier this week, Edwards pledged the state would administer all 79,000 doses of the first batch of vaccines within 48 hours of receiving them. He joined governors from Tennessee, Florida, and Texas at the White House for a vaccine summit with outgoing President Donald Trump. The state will wait until mid-January to update its income projections to account for the latest impacts from the coronavirus. The numbers set by the Revenue Estimating Conference panel will form the basis for the 2021-22 budget proposal from the governor. Setting those projections has become more difficult than usual because of the pandemic and its widespread ripple effect. Harrah's Casino will undergo a $325 million renovation that its parent company says will create 600 construction jobs and 500 full-time jobs in New Orleans. The project will include the building of a new hotel tower and, when it's done, a name change to Caesars New Orleans. Caesars is the parent company of Harrah's. The expansion is expected to be complete in 2024. State lawmakers are allowing a change for the nursing home industry that will boost their bottom line. This despite objections from groups in favor of more at-home services for the elderly. House and Senate health care committees don't plan to hold hearings on the changes planned by the Department of Health. Without intervention, the new regulation goes into effect December 20th. The U.S. Supreme Court has turned away an appeal from LSU regarding the death of fraternity pledge Max Groover in 2017. LSU has argued it should be immune from a lawsuit filed by Groover's parents regarding their son who died of acute alcohol poisoning. LSU attorneys declined comment. The Groover's lawyer says the school will now finally have to defend the case on the merits, that forcing the university to present testimony and evidence will further show why LSU fought so hard to avoid doing that. No Christmas Eve bonfires on the levees in St. James Parish this year. With COVID cases increasing, officials said there was no way to maintain the size of the crowd or social distancing. The annual event runs for miles along the Mississippi River levee. The bonfires are believed to have begun in the late 1800s.
This week, we heard from Senator Bill Cassidy as he pressed forward on a COVID-19 relief bill.
Yeah, we talked with him on a statewide conference call.
The thing that I've been particularly working on is, can we come up with a COVID relief package that can help Americans through this last phase before the vaccine becomes widely available? The way my involvement began is that there clearly was a breakdown in leadership. White House had offered $2.2 trillion, and Nancy Pelosi said it was not enough. And my gosh, and I can tell you $2.2 trillion may not have passed the Republican Senate because it still didn't include some things that we all thought were necessary. So that broke down and was not coming back together. You couldn't help but notice, though, the American people are struggling. I'd have a small business owner saying, listen, I have 4 employees. I'm not sure I can hang on for the next 3 months. I need help, and I'm going to have to lay off my 4 employees. You think about that. Somebody with a rent or a mortgage payment suddenly can't pay their mortgage or their rent. The fact that now Mnuchin and Pelosi are speaking once more, I think is clearly a response to the fact that from rank and file members, things are bubbling up. Let me say one more thing about stimulus checks. People have asked why stimulus checks are not in our bill. We're not a stimulus bill. We're a COVID relief bill. We are just trying to help those folks who are most in trouble. By the way, we're the only group that is working in the House and the Senate with both Republicans and Democrats to find a solution for the American people.
Vaccinations are likely to begin early next week, but the rollout is a process. Dr. Joseph Kanter from State Health talked with me about this amazing feat, having vaccines, but the awful realities as cases continue to surge.
The information that's been released publicly, the trial data is really encouraging, both from an efficacy and a side effect safety standpoint. We're talking about 94, 95% efficacy for the Pfizer vaccine and the Moderna, most likely too. But that's a level of efficacy that we don't see in most current vaccines. And measles vaccine is 98%, and that's the best one I can think of offhand. So that's a really, really efficacious vaccine. So it's going to do the job. And the other thing we're encouraged about is the side effect profile looks really minimal. I mean, by all accounts, this looks to be a very safe and very efficacious vaccine. The first allocations, we're talking about phase 1A, which is the top of the top in terms of priority, is really two distinct groups. It's frontline hospital and healthcare workers, typically people that work in a hospital, providing acute care to sick patients or coming in contact with their infectious materials. And it's staff and residents of long-term care facilities. So once this gets going, in the beginning, there's not going to be vaccine fairs for the public. It's going to be directed specifically to those two populations. It'll be given in hospitals to the staff and in long-term care facilities to residents and staff there. That's going to take, realistically, probably a month, maybe a month and a half to get through those two populations. Once that's done, then we move on to other types of individuals.
When will it begin to reach the general public, and how will that be administered?
Realistically, I'm going to ballpark and say summertime. I don't know for sure, but that's a fair guess, because we got to get through phase 1A, and then 1B, and then phase 2, which is more frontline workers and more people with comorbidities. And then phase 3 is the general population. Once we get there, there's going to be a number of ways that people can get the vaccine. To have a vaccine that we're actually about to give out, I mean, within a couple of days, it's going to be administered to people. To have that within 12 months of even knowing the virus existed is a scientific feat. It's probably the greatest scientific achievement of our lifetime. That said, the challenge now, as you allude to, is we're in the middle of a very dangerous time in Louisiana, potentially the most dangerous time of our whole experience with COVID. And the reason for that is cases are going up. We're in the middle of a very steep increase, number one. Number two, weather's getting colder, so people are going indoors. That's going to drive more transmission. Number three, it's also flu season, and that takes up some hospital capacity. Every year, people with flu are in the hospital. Number four, we've got the holidays. Thanksgiving, we haven't even seen a bump from Thanksgiving yet. We probably will next week. And then we got the December holidays. All of that's going to increase risk. And number five, really the most important part, is unlike the other waves, during the first wave and the second wave, when we relied on the help of medical providers from outside Louisiana. We had a naval attachment from the DOD, and we had a contractor help us with some professional medical staff that we brought in at price. Now, the difference is we're spiking, and so is every other state. So every doctor and nurse that's out there outside of Louisiana, they're going to be needed where they are. We're not going to have access to them. So the medical staff that we have here, that's what we have. There's no cavalry coming. And when we think about hospital capacity, it's not really physical space that's the limiting factor. More often than not, and particularly right now, the limiting factor is people. It's doctors and nurses and techs. I'll tell you what hospitals are going to do shy of that. Hospitals are going to start pulling the levers they do have available to them, even though they only really help on the margins. But I'll walk you through what they are. Number one, hospitals are going to start canceling elective procedures, typically the ones that would require an overnight stay. And hospitals are going to be doing this on their own ahead of any blunt instrument direction by the state. Some of them already have. St. Tammany Parish Hospital on the North Shore already has. A number of hospitals in Lake Charles already have. So that's going to happen more frequently. And the other thing hospitals are talking through is how they extend what their staff does, ask their staff to do more. Now, this is not without consequences. You think of a nurse on a floor overnight that typically cares for 5 patients at a time. They're going to be asked to care for 6 or 7 or 8 because we have to. But that's not without added risk or consequence. These are the difficult things that hospitals are doing right now. The other thing that's challenging is smaller hospitals are having a hard time now transferring more complex patients in to the larger tertiary referral centers that they need.
I'm listening to you and I'm hearing the concern in your voice sort of at a level that I've not heard at this point.
Yeah, that's accurate. And this is a messaging challenge. We've been trying to be as communicative and honest with people throughout this pandemic about what we need to do to stay safe. And that hasn't changed, but the seriousness of our predicament certainly has changed. I worry that sometimes the message gets lost because we've been saying similar things for 9 months now, but I can't stress it enough. This is, we're in the red zone. This is 2-minute drill time for Louisiana. I mean, the game is on the line right now. We got to be acting like that.
The holidays are painful reminders for many people who've lost loved ones through this pandemic. I spoke with one doctor with the Office of Public Health who told me what it's like to watch cases surge after losing someone. When these COVID-19 numbers flash on your screen, it's not always personal. For some, it's more like an idea more than it is a person with a family. But not for Gina Lagarde. She can see herself reflected in those charts and trajectories.
Over 4,300 new cases in a single day. Somewhere in those numbers, somebody got hospitalized. Somebody will be put on that ventilator.
And some people will lose their lives. Lagarde's cousin, Nadine Laurent, saw her health decline at the beginning of the pandemic. For her, it started with GI symptoms in April. Her doctors didn't recognize them as COVID-related. The big identifiers at that time were sore throat, cough, and shortness of breath. So when Laurent came in with stomach pain, the doctors thought it was just a regular virus, one that could resolve itself.
And I don't want any family member, any family to have to experience a loss of a family member right now.
Within 12 days of showing symptoms, the virus traveled to Laurent's lungs and the rest of her body. She died on her son's birthday. She was 63 years old.
I should have been able to spend this Thanksgiving and this Christmas, as I do every year, arguing on who makes the best lemon icebox pie. And that was always our ongoing argument. Or, are we going to make seafood gumbo? And just talking about the menu, and we won't have that.
At the time of her cousin's death, a mask mandate wasn't in place. People didn't know exactly how to navigate this virus. While COVID is still perplexing, health officials have the basics that people need to follow. The social distancing, the mask wearing, staying inside. But as the weather gets colder, it seems many aren't heeding these warnings from medical professionals.
And I think the sudden rise in numbers was made worse or compounded by Thanksgiving.
Lagarde says more people are getting together in spite of warnings. They're also not wearing masks or social distancing. And with the temperature dropping, it's more likely that people will want to warm themselves indoors, which is the worst place to be right now. The Thanksgiving numbers in total aren't out just yet, and probably won't be for a couple of days. But Lagarde says the state is already feeling the impact with hospital beds and low staffing. Lagarde won't be spending the holidays with all of her family members this year, but she says this sacrifice will be worth it for next year and the year after.
Well, this week, Louisiana got a chunk of money from the FCC to expand high-speed broadband through an opportunity auction. I talked with Bill Robertson from the Public Service Commission.
Internet service in rural and suburban areas has been a real issue for our office ever since Mr. Campbell took office in 2003. But the virus has lent a sense of urgency to the issue because there are people living in the country who need city services. And so we're trying to level the playing field by providing folks who live in the suburban and the rural areas the same level of internet service as people in the city enjoy now. Every time you pay your phone bill, whether it's a home telephone or a cell phone, you pay into the Universal Service Fund. And that is a very large accumulation of dollars in Washington, D.C., controlled by the FCC. Traditionally, they've used those dollars to subsidize rural voice service, telephone service. But over the last decade or so, they've widened the use of that universal fund to include broadband expansion.
What's the most important thing that comes from this for people throughout the state?
175 new locations where you can get internet service, mostly in rural areas of Louisiana. And it's going to roll out over 10 years, and it's going to cost taxpayers $342 million to deliver that service. So it's not inexpensive. But the good news is that the money's in the bank, and the FCC is ready to pass it out to these providers to help people in the countryside get connected to the internet. The drumbeat of demand for internet never slows down. There are people who buy property in the country, move to the country, live in the country, and don't have connectivity. And they constantly are contacting our offices by phone, by email, by personal visit. They get Mr. Campbell in the grocery store and say, can you help me get internet where I live? The fact that we have a pandemic now and schools are shut down means a lot of school kids are getting their lessons over the computer. And if they don't have a good connection where they live, they can't get those lessons. So the pandemic has really put a fine point on the lack of broadband access throughout the countryside and in suburban areas. We will be scrutinizing these bids carefully because even though the Public Service Commission does not regulate the internet industry per se, we regulate telephone service. And the FCC requires that all of these winning bidders not only offer internet service, but voice service as well. In the industry, it's called voice and data. Voice being telephones, data being internet. So not only will internet expansion take place, but you'll have more choices for voice service as well. So all of these winning bidding companies, there are, I think, 14 of them, representing $342 million in investment by the federal government. They'll have to come to the Public Service Commission and get certified to provide voice service. It probably won't be controversial, but we'll be in the loop on that. And that means we'll be able to help people get internet access, supplementing all these FCC dollars.
Bill, thank you so much. I appreciate your time.
Andre, I'm happy to help you anytime.
I visited again this week with Cameron Parish Port Commissioner Claire Marceau. You might remember her home was washed away in Hurricane Laura. We discussed progress and life-changing decisions being made throughout the parish, which is still reeling from back-to-back hurricanes of this fall.
I'm sitting here in my car where my house was, and I see just random debris that some of it's unrecognizable. Some of it is, I think I recognize what it is. You know, we've tried to salvage as much as we could that wasn't broken or damaged beyond repair.
When would there be some beginnings of a rebuilding for you?
Well, we've decided that we're not going to rebuild. There is a home about 2 miles from us that is repairable, and we're working with the current owner of that home because they've decided not to return. So we consider it our Christmas miracle. There isn't power there yet, but we have a generator and we're working to clean it and repair it now. We're relying on the generosity of others very much at this point. Our insurance company, Only Flood, has paid out. Doubtless that we will see anything from our homeowners policy. My husband and I are 43 and 44, and you know, we have to decide what's best for our family. And you know, it's a real question that people need to ask themselves. How will they manage to recover from significant events like this? Because they're not going to stop as they age. How will small populations continue to thrive after events like this? Cameron Parish residents are tenacious and resilient, and they're scrappers and fighters, but there are many who are not going to return. The people in Cameron Parish are adamantly independent, and they never or rarely ask for any help. There are so many people still coming to volunteer and to help.
Can you begin to name them all, or some of them?
The list really does go on and on, but we've seen direct aid from entities like the Elon Musk Foundation, the Tesla Foundation. We've seen help from the Philos, who are originally from the Lake Charles area. Those are Yahoo fame folks. The Philos are. We've seen help from, I mentioned United Way of Southwest Louisiana, the Community Foundation of Southwest Louisiana, the Council on Aging, our Cameron Parish Community Action Group. Just today, our Cameron Parish Lions Club received a $50,000 donation from Weeks Marine. Kiewit, which is large industrial contractor, Venture Global, Cheniere Energy, Cameron LNG, you name the industrial partner in our area here in Cameron Parish, and they have helped us.
Well, as you've noticed, Kara St. Cyr joins us in our LPB family, and we are so glad, Kara, that you're here.
And I'm so happy to be here. I am born and raised in Baton Rouge, and I've gone to LSU, Baton Rouge High, and I'm so excited to be here with you guys.
It's something we're looking forward to. St. Cyr, Moreau, that's about as Louisiana as you can get.
It is.
Right? Everyone, that is our show for this week. Remember, you can watch anything LPB anytime, wherever you are, with our LPB app.
And you can catch LPB news and public affairs shows as well as other Louisiana programs you've come to enjoy over the years. And please like us on Facebook, Twitter, and Instagram.
For everyone here at Louisiana Public Broadcasting, I'm Andre Moreau.
I'm Kara St. Cyr.
Until next time, that's the state we're in.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.